At 1 day old, this baby has already lived to see a funeral. His mother bled to death, giving birth, a story far too common in Uganda. Having a baby is the riskiest thing a woman will ever do here. Every year, nearly 7,000 women lose their lives because of it. But the tragedy is more than a life lost. It's the lives left behind. Losing a mother means losing a home. Women are often the breadwinners, caregivers, and educators. When they die, their children are either taken in by relatives or sent to orphanages, which is where this 1 day old boy, still unnamed, is headed. Making the arrangements is Dr. Chamberlain Froese, a Canadian obstetrician living and working in Uganda, to save its mothers before it's too late.
Well, it was a very disturbing experience to be at that funeral. It's a reminder that death is so close to so many women here in Uganda.
The good news is there's a home for this newborn at this orphanage.
The family was very anxious for the child to be put in some sort of care because they just really didn't have any way to take care of this newborn baby. So he'll actually probably come to this very orphanage.
Maternal deaths account for many of Uganda's 2.3 million orphans. It's an overwhelming number and an overwhelming problem. The solution isn't straightforward. Lack of resources and health care is one barrier, but social traditions are often the real killers of these women. So Dr. Chamberlain Froese has focused her fight in the classroom. These professionals, lawyers, doctors, and journalists, are her army. They've signed up for a 2-year master's degree program in public health leadership.
TBA friends are going to show us their little clinic.
And it will take leadership and years to dismantle cultural beliefs about pregnancy and childbirth.
There is belief and practice that women cannot control resources, and quite often is one of the inhibiting factors that a woman or a mother cannot take a decision quickly. Say if she's in labor and the husband is not around and you have no resources, you still have to seek your husband's consent.
That's why it's so significant men make up half the class here. They are key in changing cultural perceptions. Obed was one of the first men in his village to see his child being born.
And what are your thoughts after seeing childbirth?
It's interesting. I was sharing with my wife, do you think we should have another baby? And she was like, you know, you saw what happened. What do you think? So this came out of experience, you know, and she, you're able to make decisions that about birth planning, about care and support for a mother. After attending this, you know, there's a way it brings your sense of understanding.
It's an issue that affects the whole community and economy, according to another Save the Mother student.
For every woman that dies, 6 women remain or live with a disability. And to me, as a woman, member of parliament, and as a leader, I think this is a very, very serious problem, not only for women, but for a country. Well, women's health is a development issue, not necessarily a women's issue.
These students are already teaching others, the future mothers and fathers of the country. Dr. Chamberlain Froese couldn't be more proud. Although the program started off as her baby, it's grown and become part of an extended family. In the meantime, the mother of 2 has her own clan, one that's about to expand. Today, they're going to visit their new daughter at a local orphanage. This is the other labor of love in her life.
From what we know about her story, she was about 6 to 8 weeks old when she was abandoned at a hospital in southwestern Uganda. And so she was brought in by the hospital and kept for a while, and then eventually she was brought here to this orphanage in Jinja, where she has really spent the first 3 years of her life. Yeah!
Still, the Froeses never expected they would adopt a child.
Late last summer, through circumstances, we started thinking of having a 3rd child. And we said to ourselves, if we have a 3rd child and it's a girl, we'd like to name her Hannah.
It was after suffering their own pregnancy complication, a miscarriage, that God gave them a Hannah.
Never knowing that we would adopt and never knowing that we would visit an orphanage and the first child to reach her hand out to us would be this little girl. And I asked, what's this little girl's name? And we were told, well, this little girl is Hannah. We feel it's a bit of a God thing that the name was presented to us. And another interesting little sidebar is that my mother's name was Hannah Laura. And so we've named this Hannah with the middle name Laura now. And then we've called her Marimbi in addition to, so her full name is Hannah Laura Marimbi Froese. And Marimbi means peace in Lugandan.
They still have a few months to wait before Hannah moves in. That's why visits like these are so important. Already, the kids have bonded, though they notice Hannah doesn't smile, something they hope to change.
Any child that has spent 3 years in an orphanage is going to have some issues, and any adopted child often has issues as well too. But I think the future is bright for Hannah as well too. She's a bright little girl, and I think she's going to do well.
The unknown is there, but such is life, and we walk to it gladly.
Hannah is no longer an orphan, but her story is rare. International adoption can be difficult, but some have found a way to make it happen.
For me, I have to live here for at least 3 years before I can take my son home back to Holland. So it's pretty long, but it's worth it.
This woman's son is among the orphans here. And though the kids are well fed, clothed, and have toys, they don't have a mother, something that is priceless.
This is a good orphanage. I've personally looked at the facilities here, and I think people here are very caring. They have resources from outside, but I'm sure all of us can appreciate that an institution is not really the right place for any child to be grown up.
These faces tell the real story of maternal mortality, a tale of tragedy and unnecessary loss.
If you're happy and you know it.
One Dr. Chamberlain Froese hopes to rewrite.
We need to keep fighting. We need to improve the services for mothers in this country so this doesn't happen anymore.
In Mukono, Uganda, Denise Lodde, 100 Huntley Street.